Okay, you're welcome.
Thank you.
Yeah, stylist.
Yeah.
Alright, so what brings you to my practice?
Yeah, so I've been having this pain on the right side, my elbow, and it's been going on for so long. It's affected my life. I want to see if you can do something about it. Yeah, I want to be able to go back to my normal life. You know, I want to garden, go back to work, do my household chores. Yeah.
Okay. Can you remember how the pain started? Was there a wound? Do you have any cords?
No, actually it's very interesting because I can't remember how it started.
Okay.
I just remember feeling pain at work. I also play tennis.
Okay.
So I remember feeling pain over here and I didn't know.
You play tennis?
Yeah.
Oh,
Yeah. I didn't know where it was coming from, and I thought with the time it would pass, but now it's been quite some time and it's still there.
Okay.
Yeah.
So when it started, what did you do?
When it started, I tried to take some rest as much as I could, but at work I'm really typing a lot. I still feel some pain on my elbow, and I liked, as I said, playing tennis and gardening, and that was affected. So I couldn't really stop it that much, but I tried as much to reduce the amount of activity I did. Yeah.
I looked at the referral from your doctor.
Yeah.
So he said he had done some tests. What kind of tests did he do?
He just, I forgot the name of the test, but he just did some tests to see if the muscles there were okay, and he did some tests where he pulled my finger down and it caused the pain again there.
Did they do x-ray?
They did x-ray, yeah, but nothing showed up. Yeah.
And it's been on for more than 6 months. No open wound.
Yeah.
You didn't have any trauma.
No, nothing. It's just been continuously for 6 months now. Yeah.
Can you tell me the intensity of the pain when it started and now?
Yeah. I mean, when it started, it was about 5 or 6.
Yeah.
And now it grew to like 7 or 8, you know, sometimes.
Yes.
Yeah. When I use it more, it's obviously the pain is higher. Yeah.
So that's why it's limiting you now more.
Exactly, yeah.
Because the pain is increasing.
Yeah, correct.
There is no open wound.
Yeah.
Oh, sorry. I sympathize with you. Okay, now I would like to know how it affects you. You know, when this pain starts, what areas of your life, like your activities of daily living?
Yeah, mainly, I lost my job because of this, because I couldn't stand typing. But thankfully, I turned to my hobby, which was gardening.
Okay.
And I was able to kind of make money from that.
Okay.
Because I make my own plants, I water them, and then I sell them.
Okay, that's good.
Yeah, but household also was affected, where I had to rely on my wife for most of the things. Yeah, so
that's serious.
Yeah, I couldn't do a lot of things, and the burden kind of went on my wife, you know. Yeah. So it affected everything where I did my hands. Yeah. Okay.
Then when this pain starts, because I want to look at the psychological impact of it, how do you feel when it starts?
Yeah, I'm so annoyed because I like to do things myself, and when I have to rely on my wife, it doesn't sit well with me. You know, and I do notice sometimes she's a bit frustrated as well. But there's nothing I can do. You know, if I'm in pain, I'm in pain.
Yes.
You know, when I ask her for help, I notice also she's getting and she's frustrated with how long this has been going on, because she feels more. She's working as well, and she feels the pressure is there to do her part and the part I would do. You know.
It's really not easy.
Yeah, it's not easy, but yeah, with the gardening, it has affected me because I'm not able to make as much money now.
Yeah.
So financially, it's a bit worrying to me.
Okay.
Yeah, because before, when I first stopped my job, maybe I could sell 5 or 6 plants per week, but now I'm barely doing 3, you know. and
And the work is no longer there.
yeah, and there's no work, so I need to make money somehow, you know. Yeah.
Okay. Is there any other part of your body this pain is affecting?
No,
It's just the
it's
hand.
just specifically here.
Yeah. Okay. Then what of your social life?
Well,
How has it affected your social life?
Yeah, most of my social life was at tennis, at the tennis club.
Okay.
So we would meet with friends, and then we would first play tennis, then after have a drink or two. But then because of my elbow and resting, I'm not really going anymore. So once in a while, my friends miss me and they're like, oh, come to my house, we'll have a few drinks. Or I try to invite them, but there's not really much I can do to host them.
Yes.
So I'm seeing them less. I'm also not seeing my colleagues since I stopped working there.
Yeah.
So my social life has gone down the drain right now. Yeah.
All right. There are things I'm looking at.
Yeah.
Because this is a pain. The onset, you can't really pinpoint exactly how it started.
Yeah.
Now it's affecting your activities of daily life.
Yeah.
It has made you lose your job.
Yeah.
Even the little you're doing is also being affected.
Yeah.
Your social life and psychologically is making you worry a lot.
Exactly.
Yeah, so there are things I suspect which will like come up and call hypothesis.
Yeah.
Which I'm going to test.
Yeah.
I'll assess and watch you do the gardening part that is mostly affected so that I can continue with that. Then when I check it, I will find out if what I suspect is wrong with you is actually what it is.
Okay.
So I would like to see you do it, then I observe it.
Alright.
Okay. So there are plants here. Then I would like to see you water. First of all, let me have a look.
Yeah. Yeah.
Okay, can you hold your hand? Okay. See, it's on this side.
Yeah.
I'm trying to feel it to check the muscle tone because I've looked at it. I can't. It's not red. It's not swollen. Nothing. Then bring it towards your hand. Okay. You feel this place. Do you have pain in these places?
No, I don't.
No pain. Just concentrated.
Yeah, just here mainly. Yeah.
Okay. So let me see you do those activities. Is the container you use? I know it's bigger than this. Yeah, but I would like to use this as a substitute. Yeah. So you say up to what kg do you carry?
I go by liters. So I do around 3 liters.
Yeah. Okay.
So I do about 3 liters. Yeah.
Okay.
Yeah.
So what will happen is I would like to observe you do that and we'll see how I want to watch how you handle it. Yeah, then let me see. Do it, let me see.
Okay.
I'm timing it.
Okay.
So when you start feeling pain, let me know. Okay? Okay. Yeah. So you're getting the pain now?
I feel pain now,
Okay. All right. Then I'll conduct, I'll conduct the other examinations, like to test if you have a tendinopathy there and other things.
Okay.
So, we have finished. The examinations, and I'm going to discuss the result of the test with you so that we can proceed with the treatment. When you were doing some of these activities, I tried raising some psychological questions to know if it's affecting you, like the stress and worries you've been going through. And I noticed that the more I talk about it, the more your facial expression changes and other thing. Then I also noticed that you have no idea of what the cause of this thing is. Yeah, you can't really say what it is, which I'm going to explain to you. Something we call chronic pain. I need to educate you first on what chronic pain is, so that you can have an understanding of what is going on. The tests I conducted, actually some were positive, some were negative. Now, and I also issued you a question paper to fill. It's a questionnaire where we check the impact of psychological influence on chronic pain on your own, in your own case. So from what you filled, it actually proves the effect of psychological influence, then the lack of knowledge on pain. So the treatment I'm going to give you first is to educate you, what we call pain education. Then what we call graded activity. We're going to teach you how you can start doing this gardening. We are taking pain off the radar. Forget pain. By the time I finish giving you the pain education, you understand why you have to forget pain and then start your activity. But you are going to take it easy. And so that's what we mean by gradual activity. So we'll now move over to the treatment proper. Thank you.